I'm Scott Ogburn. I am with IMA Financial, been in the employee benefits business for 26 years. Doesn't necessarily know or mean that I know a lot. It just means that I've experienced a lot in the 26 years, especially when it comes to controlling cost and chronic conditions for the memberships that our employers have.
So, Scott, what's something that you know that you think more people should know about running their employee benefits program?
Yeah, so JP, I think a lot of folks just don't always understand that there is information in the data, and data has power. And so when you start looking at an employer-sponsored healthcare plan and you start to look at what's truly driving the cost, it really gets down to about 20 to 25% of the population. And of that 25% of the population, you can impact roughly 20% of that, and change the trajectory for that employer over the next 12, 24, 36 months.
So why is that?
Well, if you think about it, 25% of the population is driving somewhere around 75% to 80% of your spend. And what we typically find is it's individuals who have chronic conditions like diabetes, hypertension. And what happens in our healthcare system today, as you know, JP, being in this business, the doctor's office visit has really come down to about a 4-minute visit. And most of the time in that visit, your doctor or the nurse practitioner that you're seeing has their back to you and they are just typing things into an EMR, and they're never really having dialogue with you as the patient. So what happens is people leave the doctor's office being newly diagnosed and have no idea how to control their chronic condition. So they're left to searching Google, doing some kind of AI search instead of sitting down with a true medical professional and mapping out a strategy to lead them to a better path over the next 5 years. For these patients who leave the doctor's office with that 4-minute visit, not having the true education, what happens is that's the individual who has a condition that is just deteriorating. They don't know how to manage that condition, so they continue to have bad health. They continue to bleed financially because most of those conditions end up being subject to a deductible and co-insurance. The more that disease deteriorates, it doesn't get into office visit copays and drug card copays. It actually gets into inpatient or outpatient hospital stays. So all of a sudden, now you've got a member on your healthcare plan that's costing you personally as the employer. But think about it from that employee seat. All of a sudden now, 20% of the take home income that they have is going to their deductible and co-insurance, or they're spiraling out of control year over year, and it gets into just medical debt for them. So now they have collection agencies calling them because of their chronic condition that can very well easily be controlled.
So how do you get them to control their chronic condition outside of the doctor's office then? What's that look like?
You're going to structure that program at your annual renewal. So you're getting a increase in your health insurance premium, or maybe your health insurance premium is being flat. And what employers want to do is they want to create an incentive. Some employers would say it's not an incentive, it's a stick. And so we do a premium differential between participating in the disease management program and not participating in it. So we rule of thumb, we'd say $50 a month for an example. If I participate in the disease management program, my premiums are reduced by 50. If I have my spouse on the plan and the employer would like to do so, they could give an additional $50 reduction for the spouse. So $100 reduction on a monthly basis, $1,200 a year. I mean, that's a pretty good take home increase for an employee if I'm making or taking home $1,200 more. From that point, JP, what we typically do is we will ask the member to complete a health risk assessment form. And that is a form where they go online, answer the questions, submit their blood work from their most recent doctor's visit, That data is submitted to our, as we call it, life cycle nurse. The life cycle nurse then evaluates that HRA, reviews their blood work, and schedules the first appointment with that member on site during normal working hours at the employer's office. And so that is typically step one of the process.